Thank you for watching Lira Scoop. We are glad you are here.
Lira Catholic Diocese. Thank you so much, Sister who led the team, and Reverend.
I want to warmly welcome you to Lira City, and specifically today when we are launching our national program for scaling up the prevention and treatment of sickle cell disease in Lira Regional Referral Hospital and the lower health facilities in Lango sub-region, together with the wellness clinic and laboratory, as you have heard from the previous speakers. Uganda faces one of the highest burdens of sickle cell disease in the world. Yet we believe this silent crisis can become a story of survival, resilience, and equity. Each year, an estimated 20,000 Ugandan children are born with sickle cell disease. And without timely diagnosis and care, up to 80% will not live to see their 5th birthday. This is not just a health statistic, it is a matter of justice and human dignity that calls for urgent attention. We know that the tide can turn. Across Africa, governments are stepping forward to elevate sickle cell disease as a core priority within national health and non-communicable disease strategies. Our government has already begun charting this course, beginning with a nationwide survey done through leveraging the HIV early infant diagnosis routine surveillance. Uganda became the first in sub-Saharan African country to have a national sickle cell prevalence data. For optimal use of limited resources, we initiated targeted newborn screening in high-burden regions, as indicated by the survey. We set up sickle cell clinics in over 100 public health facilities, which are also participating in newborn screening. We have mainstreamed sickle cell program within the non-communicable disease department. To make sickle cell part of routine service delivery, we have integrated sickle cell care for long-term care and follow-up. We have promoted the use of hydroxyurea as a choice drug for management of sickle cell patients in public hospitals and clinics, and building long-term system capacity. We have also engaged key stakeholders, including cultural, religious, and political leaders, outlining their role in this effort. These are not temporary interventions, but deliberate steps to institutionalize sickle cell disease as part of routine national service delivery. In doing so, Uganda is demonstrating that comprehensive care for sickle cell disease is possible and sustainable. For sickle cell disease, the question is no longer whether solutions exist, they do. The real question is whether we as leaders will choose to act with urgency and scale. I am happy that today we have launched the national program for scaling up not only the treatment but also the prevention of sickle cell in Uganda. The Ministry of Health deliberately chose Lira City because the statistics indicate that Lango sub-region has the highest sickle cell disease incidence in Uganda. This launch commits us to exploring innovative pathways for sustainable financing, leveraging sovereign leadership to crowd in private investment and align resources for long-term health sovereignty. But at its heart, this is about political will. The call we are making today is not just for funding, it is for intentional mobilization of community leaders to create mass awareness about this crisis. The need to scale up testing, care, and treatment to the lower health facilities, and the need for a new policy framework to guide these interventions. In this regard, I am happy with the several citizen-led task forces that have been formed to strengthen government's efforts against sickle cell disease. I am also using today to direct the Director General of Health Services to appoint a national task force to draft the policy framework for the prevention and treatment of sickle cell disease. Stands ready to lead and to join hands with other stakeholders to make sickle cell disease not a sentence of suffering, but a story of hope. At the same time, Lira Regional Referral Hospital has established a wellness clinic laboratory to support early screening and prevention of disease for the region. I encourage all of you to come and check yourselves so that you're able to prevent any disease or treat the disease if caught early. With those remarks, I now declare, I'm going to begin my declarations. I now officially launch the program of scaling up sickle cell disease care, screening and testing in Lango sub-region. I declare it officially launched. 2, the different task forces, citizen-led to strengthen government's efforts against sickle cell disease, officially launched. 3, the Wellness Center, Clinic, Laboratory at Lira Regional Referral Hospital to support Lango sub-region, officially launched.
The treatment center for sickle cell at the Lira Regional Referral Hospital is very busy. As I provided earlier, we attend to 1,500 children and young adults enrolled into the clinic. So from this group, there are those who come from within the city, and then there are those who come from the neighboring districts of Lango. Among them, we also have those that have been already enrolled on hydroxyurea, which is a special drug that we do give to the sickle cell patients enrolled into the program. So those enrolled into the hydroxyurea drug, they are at 64% out of 1,500. The rest, as the drug becomes more available and accessible, we believe that we are going to enroll more so that these children are able to live a crisis-free life and they're able to thrive and achieve their goals and dreams.
Well, quite initiatives launched today. How will this help?
So this initiative here today is going to help in one way. Is going to help is that we are no longer talking about the Regional Referral Hospital only. We are not talking about all the health center force within Lango sub-region. We are going to build their capacity to monitor the patients who will eventually be started on hydroxyurea but also these lower facilities will be able to screen more people in the community so that we identify people with sickle cell and provide treatment early, ahead of time.
On behalf of the Muslim, we have already taken this commitment that we are going to commit ourselves to make it a string under our mosque to see that to curb the influence of the increase of sickle cell. We're going to always make it strict for couples to get into marriage when they are free from attracting more other sickle cell sicklers in their houses. And by this, they're supposed to test themselves to make sure that at least a partner does not have, maybe if they're to go on, like if one is a carrier, then probably the other one should not have. This is a very big step that we are going to do to make sure that in under our religion, then probably we can also commit ourselves to support us all in Lango to see that we struggle to push away the sickle cell in our region. Thank you so much. Thank you so much.
Geoffrey Aceng Nabia, Deputy Minister of Health, Anna Wonyashe Melao, Engineer Dr. Moses Michael Odongokune. This arrangement of sickle cell that is being launched today has a serious impact on our region because the research is indicating or demonstrating that on a yearly basis, close to 20,000 babies are being born with the sickle cell disease. And the prevalence in Lango sub-region here is also alarming. In Lango sub-region, of the 10 districts we have, the district with the highest prevalence is Aleptong, and the sub-county in Aleptong leading is Adwe. Now, as cultural institutions, we have come with some mitigation measures that we intend to carry so that we try to reduce on the prevalence. Example, we are going to make it a law in our cultural institution that before you get engaged or married to a boy or a girl, you must present your sickle cell card indicating that you are free of sickle cell. Because when we do that, it is going to help us to reduce on the prevalence of this disease in Lango sub-region. Also, we want to use the already established government structures where these agencies should use us as we talk, so that we carry out massive mobilization where we go to all the districts in Lango using our cultural structures and we do massive testing to our people, so that from 6 years to around 40 years, you already know your sickle cell disease status, where before you get engaged into any issues to do with relationship, you present to your partner your card, so that when you get married, you know that I've gotten married to a lady or to a boy who is free of sickle cell. Thank you so much.
Thank you for watching Lira Scoop. We are glad you are here.